I've been on PatientSite since I started working here as an attending 10 years ago. It's very useful, and the better the site gets, the better the experience is for patients and also for providers. You know, I think confidentiality is very important in healthcare, and particularly with medical records. My understanding is that the way this program has been developed and the way PatientSite's been developed, that it is HIPAA compliant and that there's encryption and protections.
I think if you have a choice, you should always be using a secure site. So that if you use plain email, that email message goes through multiple computers before it gets to the patient or back to you. Multiple people, if they know how, could access and read it. And so it's not secure. One thing that PatientSite does well is that it takes away that insecurity of email. I still have a rare patient who doesn't like using the website and insists on using email, but I explain to them that I don't really think it's secure and I would prefer they use the portal. And also, the PatientSite messages are automatically saved in their record, whereas the email I have to cut and paste it into their record, which is a pain.
I like PatientSite for that reason, is that I can very quickly pull up a patient's chart and see the trail of emails, because often it's a discussion and conversation on PatientSite, and on regular email it sometimes gets lost in the work-related email. So it's helpful to link the email discussion with a patient so you can kind of see how the discussion is going, and then just look at the different points at which, for instance, care was changed, if the dose of a medication was changed, or if I recommended a patient that they watch their symptoms for 2 weeks and then get back to me by email, then that's clearly on the chart, and I can easily pull it up. I prefer that patients use PatientSite rather than regular email.